It is fulfilling to teach them to be able to save lives on the battlefield, not take lives. I teach them not to lose their humanity. Yes, there are evil people in the world, but that does not mean they need to be evil as well. Our role as medics here is to train the Ukrainian soldiers that are brought over here in combat first aid, which is also known as Tactical Combat Casualty Care, or TCCC.
I have one question to ask you. How do you take a pulse?
The main aim is to help the Ukrainian soldiers identify and treat preventable causes of death, because we want to give everybody a chance to survive on the battlefield. Yes, people die. It is part of war. That's a sad reality. There's no silver lining. And not everyone is going to be trained to be a medic. However, we have the duty to provide basic life-saving skills to all branches of the Ukrainian armed forces.
If he doesn't have a pulse, what could that mean?
Common types of injuries that are seen on the battlefields are what we call massive bleeds. Basically, a human can bleed out in as little as 3 minutes. So the tourniquet is one of the greatest medical devices that a soldier has at their disposal to treat themselves or others in order to keep them alive on the battlefield.
Even though it's obvious the 2 sucking chest wounds, you still need to look for any other holds.
Some of the other common injuries we're finding on the Ukrainian battlefield are from blasts. These are usually from artillery or most commonly drones. So we teach the students common wound patterns from these weapons that deliver these wounds to the soldiers.
So if it's this leg, we can pull them over and keeping low.
The types of training we're teaching conscripts and volunteers are tourniquets, bandages, chest seals, blankets. These are the main items we use on the battlefield in combat first aid settings, which help save lives.
So you notice he's still struggling to breathe, and then when you have a look at it, this side isn't rising and this side is.
It's important we keep these scenarios as realistic as possible, because seeing these wound patterns now will help desensitize them to the real ones that they find on the battlefield, and this will help save lives in the long run because they will not freeze. You see some students that freeze for 30 seconds or more, and at that time the casualty is losing lots and lots of blood. The more blood you lose, the higher your chances are of dying. Traditionally, we use helicopters to evacuate casualties. Now you have a war where it's a conventional military versus another conventional military, and you also have the threat of drones. So what does that mean for our students? They are not likely to get a helicopter for evacuation on the battlefield. So we have to teach them drags and carries, as well as how to use a drag stretcher on the battlefield, because that is the most likely way they are going to be evacuated or evac a casualty. Traditionally, this course can be run back home in New Zealand in about 5 days, and usually our course ceiling is about 12 people. However, here we can have around 200 students that we need to get through in a 2-day period. Is it enough? Definitely not. Some of these students were only civilians 4 or 5 weeks ago, so most of them knew nothing. And they've got so much knowledge to take in, not just from medicine, but every aspect of military life. This is their basic training. So it is challenging. However, we always make the wheel go round. But yeah, for me personally as a medic, It is fulfilling to teach them to be able to save lives on the battlefield, not take lives. There is a sense of pride delivering this content to them. The Ukrainians have taken a liking to us as we have taken a liking to them. It is giving these soldiers who were literally civilians a few weeks ago the skills they need to be able to survive on the battlefield, or at least a chance.